Good morning, everyone. My name's Diana Metzner. As you can see, I'm from Telc Language Tests, based in Frankfurt. And I've got my assistant with me, who in real life is my boss, but today she's my assistant, so that's nice. And the first thing I'd like to say is that if you want to have a copy of the slides afterwards, just write your email on one of these lists. There's one on both sides. So just write your name down, and then you will get sent the slide, so you don't have to make lots of notes now. Yes, I was a bit tired of all this dark blue we've been seeing all week, so I decided a bit of nice Scrubs green would be useful. So does anybody here speak German? One out. Ah, good, because you can read it all in German. Right. OK, so the TELC is the European Language Certificates. So we do lots of certificates, I think over 50 now in 11 different languages for all Europe. And what I'm not doing here, it's not a product placement, because we don't actually have an English-speaking product. So I'm speaking generally about the topic, and I'm basing my knowledge, or what I'm going to say, on our German exam. So that's what all this green stuff has to do. You may have seen people wandering around with these little doctors. This is our TELC stress doctor. Everybody needs one. And this is just a little reminder about what we do. Anything you need, please come to our stand afterwards. I'll explain about that in a moment. All right. So at the moment, we provide these two health professional examinations. You can see there's one for doctors, dual level, B2C1, and there's a nurses one, B1, B2. Here's a quick overview of today's talk. Obviously, I'm going to start off by saying, why do we need these exams, or why do people need exams? Then talking a bit about how TELC has decided to address this need, and conclusion is how it goes on from there. OK, so why is there a need for language tests for healthcare professionals? The same all over the world. I think the developing countries need more and more health service professionals. They come from other countries, and they may not speak the language as a native speaker that in the country that they now are. It's what happens in Germany, it's what happens in England, it's what's been happening in Australia. It's really a sort of global phenomenon. So that's why we need these tests. The acute shortage of personnel, which has to be able to speak the language in the required way, which we will talk about. Now, within the EU, we have your mutual recognition of your professional qualifications. That's all right. But the question of how one decides if the person can speak the language at the right level is not quite so clear-cut. That's where our exams are going to start. Particularly in Germany, the situation is a bit different or a bit complicated, because we have a federal system, and each federal land has decided to have slightly different recognition ideas, slightly different criteria. And of course, it would be better to have one exam and make sure that everybody took this one exam. So that would be nice. So let's go on to what kind of examination one requires. Now, I know that certain countries or certain bodies say, let's take a generic test and say the person has to be at whatever, B2 or whatever. Or others say, well, perhaps it ought to be a profession-specific test. OK, so a general, generic, all-purpose test, we all know what that is. And that's what it the ability tests. And if we were to have a professional specific test, it would test the same language ability, but in a specific context. Then we go on to how the tasks are going to be. You have a generic task for thousands, millions of people. They have to apply to all sorts of candidates, different ages, backgrounds, interests, motivation. Wouldn't it be much easier to have a task that was already to do with what the people are going to be using the language for when they start work? So you've already got the right age range, you've already got their prior knowledge, their education, and of course you can appeal to their motivation so much better if it's directly what they're going to be using. Here we are. The tasks tend to be neutral, so as to be politically correct, that kind of thing. And here in our profession-specific test, which we think is better, you've already got the kinds of interactions they're going to be needing. So that's why we started off with these exams. The nursing staff exam was introduced in 2013. It's called Deutsch B1, B2 Pflege. Pflege just means caring. And so it's basically for nursing staff, as you can see in the picture. There's nothing sort of perhaps extraordinary about the exam. You can see the various characteristics of this exam. It's a dual level exam. It's a pen and paper format because we say the people are already there, they're already in the country, they're learning for this exam, so why not give them a perfectly ordinary pen and paper test? And there are lots of extra materials. Then we have something equivalent for the doctors. In Germany, we are not testing doctors who want to go into private practice because that basically doesn't happen. So health professionals from other countries usually go into hospital work. So here is everything we will need, or everything you would need. And we say the test is not enough. We have the test experience encompassing all these things, because it's basically a package. You have your group of new people coming from the other country, where they've got their professional qualification, but they've got to do something to make sure that their language is okay. So there are courses, there are this instruction, they can work at home, they can do mock exams, etc., etc. And then, of course, you have examiner training. We do the whole package. All right, so now back to one topic, which is the communication in the medical setting. And so the first thing, last year I was in Harrogate and I went to a bookshop and I suddenly saw this card. I don't hope you can see it all right. The Interpreter's Guide to Doctor Speak. Okay, what your doctor says, what your doctor means. Now this just indicates that anybody buying a Get Well card knows that doctors tend to speak in riddles sometimes, even though they are not migrants, or maybe not be migrants. It just shows how complicated this kind of thing is. I rather like this one. Bend over. What does bend over mean? Well, bend over means bend over. Some things are bad enough without a deeper meaning. Okay, this is just a sort of humorous work in towards our topic, but it just goes to show the patient is on one side, the doctor is on the other side, and the communication is not easy. All right, and that comes back to what language we teach, or what language has to be taught, and what language has to be tested. So we have what you would probably imagine: medical jargon, specialist jargon. Then we have what we call professional language, and we have general language. So really these new nurses and new doctors have to be able to speak these 3 different types of language. Now, general language, not only as in your general language exam, but the sort of general language that patients, for instance, would be using. The medical jargon is perhaps the easiest to learn. You just learn it. And the professional language is also the difficult one. Okay, so let's start with this one. Do we all know what is being talked about? All right. So this is one of the classical situations where the doctor is thinking in his medical term. The patient is full of taboos or thinking of, oh, how do I say it, using some sort of euphemism. And here is a penny. Does that remind you of anything? Spending a penny, right? Some people will know this idiom. Some people will not know this idiom. And if you teach, you may need to teach this kind of idiom because the cultural sensitivity means that your doctor or nurse from another country who is now in your country trying to deal with the patients will have to understand these kind of idioms. And apparently, what happened in a Norfolk hospital was the foreign nurses, and I think they came from Portugal, didn't understand when the old lady said, I want to spend a penny. And they took her to the shop, thinking she wanted to buy something. And after this had happened, the people in the hospital management suddenly realized that their Portuguese nurses didn't speak the same language as the Norfolk old ladies. So that happened. That was an article in the Guardian newspaper. And that was something that became known because everybody could understand that there's a problem here that has to be dealt with. All right. So my conclusion from this, you need to use different varieties of speech at the workplace. Here we have this typical situation of the, okay, these are all actors, but we assume that they aren't. There's an old lady in her hospital bed, and then the consultant comes in, and he's surrounded by his minions, and asks how Mrs. Smith is. And so this young doctor is sort of saying everything in typical, well, I would call it doctor speak. No, it's really, she's using these medical terminology. So basically, she can't spend a penny, shall we say. So she's suggesting doing MCU. I had to look up what an MCU is. Let me think, just so I can show off. Let me see, it's number 15. It's micturition cystourethography. Okay, but obviously she just has to learn, it's called an MCU. Everybody has to learn what an MCU is, and of course the patient doesn't have to know what that is. Probably better that she doesn't. There's another one. So the nurse has to decide whether the person she's talking to is going to understand the rather more polite way of asking, or whether she were just going to ask, does it hurt? So there again, the nurse has a choice, has to use 2 different registers. Perhaps of course, the patient is not necessarily going to be a native speaker of the language either. So perhaps it might be too complicated to say, do you have any discomfort? Because that's once more one of those euphemisms. So it might be better just to say, does it hurt? Okay. So let's get back to the oral examination. These are the things that are going to be are going to be the scenarios in the oral examination. You need your handover meeting, you need your history taking, and you, very important, talking to the patient or the relatives or carers. So sometimes these are asymmetrical conversations with one person in power and one person not, or they might be on the same level. So it's good to incorporate all these things into the exam so that people will be able to practice real life. Written examination, okay, that's quite easy. You can say, okay, they can practice writing a fact sheet or a discharge note or informal emails or the patient history. In fact, the sort of things that the nurses and doctors are actually going to have to do in their professional life. So why not practice them and why not test them in the exam? Right. Now, the interesting thing about the CEFR, as I'm sure you all know, is that the CEFR is not prescriptive. It means it's there and you can adapt it for your own use. And just as an example, we have the descriptor for listening, and we have listening C1, the overall listening comprehension C1, which is, C1 is what we say that the doctors, or what normally people say the doctors have to have. All right, so it's this black bit or brown is the normal CEFR descriptor, and I've added in green the sort of aspects that have to do with, or that would have to do with professional, can you see it all right? The professional health, the health professionals. For instance, may need to confirm occasional details if the accent is unfamiliar. So that could be a lecture on a new aspect of treatment that the doctor is happening to listen to in the language which is not his or her native tongue. Can follow extended speech even when it is not clearly structured, and it may well not be clearly structured. You have an anxious or a confused new patient doing the history taking, and they're not going to talk like a scripted piece of information that you just have to listen to. So you have to learn how to listen under these kind of more difficult conditions. Here's another example for reading instructions, B2. So this could be the physician or it could be the nurse. And this is taken directly from the CEFR. And just as an example, you could call it instructions about hygiene precautions or about security measures. So they'd both have to be able to read those. Here again, we now have writing, writing reports and essays. Of course, the doctor has to write reports and essays. And the doctor might have to write a slightly more complex one compared with what the nurse having to write, because it might have something to do with the insurance or that kind of thing, the report to the insurance company. So it's a bit more demanding, and so that's why I'm calling it referral or discharge letters. And now, of course, this most important, I still think, is speaking. The overall spoken interaction, that's at the lower level, so that's B1. All nurses should be at B1, definitely. Okay, it says can communicate with some confidence. We're not expecting them to be all that fluent, but they still would have to explain to a new colleague how to work a machine or give simple instructions to a patient during a medical examination. So that's the wonderful thing about the CEFR. You can relate it to your situation, and then you can calibrate what you're doing, and then you know that if somebody has passed your exam based on the CEFR, then they are at that level. This is, in fact, what these two nice green posters are about. There's a poster for nurses and a poster for doctor. I'm afraid it's all in German at the moment, but still it just shows you have your 4 skills and you have your CEFR descriptors about professional health professionals. Right, so I'm now on the benefits of the test experience, and We mustn't forget the stakeholders, because they're the people who are deciding to do it. Compared with a general English or German test, they know what the test is for. They realize it's fit for purpose. They can understand the rationale of the test. And it's useful for them. It will help them to recruit the right people. And they can also use it for on-site training. And the candidate, the international health professional, for them it will be the gateway to employment, or they can acquire more confidence. And number 3 is very important, the gain in patient safety, because you might have a case where the nurse or the doctor has understood something wrongly or has given the wrong instruction or something, and then there's a big incident. And the less of that happens, the better it is, of course. All right. And once the candidates have been on this course, or they've got the exam, they realize it's much easier for them to communicate with the patients, with the co-workers, and it's going to be nicer all around. Oh, wait a minute. That was a bit too quick. Here's really the same. Again, split in a slightly different way. So this is why I think that a tailor-made language examination for health professionals is so much better than just using a generic one. I already explained that you can align everything to CEFR. You can use the descriptors. You can have tests and teaching materials to help them learn. Right. So this is my conclusion, or one of them. And that's what we at telc think, that this is really the only way to make sure that your migrant health professionals are going to do a good job, are going to feel good, and the patients and the colleagues are going to be pleased with them. And not to forget the host country's culture of welcome. If the migrant professional comes to a country and it's all organized for them and they can learn language and it's all worked out for them, that's really part of the culture of welcome. So when you get, if you are interested, you will get the sources that I've been using. Well, one of them's in German, the rest are all in English. The sources you can then read it all up. And of course, you can come contact us at our stand. And we have a couple of more minutes. Oh, I'm doing rather well. We have a couple of minutes for questions, where my assistant will answer the questions, or well, perhaps he won't. And this is why I say thank you for my, wait a minute, just one more, no. Right. By the way, I'm also on Facebook. I'm called slightly differently on Facebook, but you can see me there. Or come and visit us at our stand. And come and pick up your little doctor to remember us. Thank you very much.